friends, welcome back. For those of you who are seeing me for the very first time, I'm Jasan, and on my channel I share my experiences with motherhood and lots of helpful tips for mom and baby. Thank you so much for joining me. In today's video, I will be going over everything you'll need to know about constipation in babies, starting with the signs, the causes, and the treatments for babies at various age ranges. First thing to note here is that every baby is different. Babies that are exclusively breastfed may have daily bowel movements, while others may go once per week. This should not be cause for concern unless this is unusual for your baby. It is also normal for babies to grimace, cry, become red in the face, and make sounds while having their bowel movements. This does not necessarily mean that they are constipated. Babies that are breastfed rarely become constipated, while constipation is very common among babies that are formula fed and babies who have started on solids. So let's talk about the signs of constipation. Number 1, a lack of bowel movements. You will start to suspect your baby may be constipated if their bowel habits have changed and that change is ongoing for more than a few days. This is why it is very important that you monitor your baby's bowel movements. Number 2, fussiness. Babies may become fussy for several reasons. However, if the fussiness is accompanied by any of the other signs, then constipation must be considered. Number 3, spitting up more than usual and the changes in their feeding habits. So baby will start to eat less. Number 4, difficulty passing stool. Number 5, passing small pieces of hard stool. Number 6, blood in the stool. This is a result of tears to the anal wall from forceful pushing. Number 7, visibly bloated tummy that is tender to the touch, meaning baby will cry if you try to rub or touch their tummy. Their tummy may also feel firm. Number 8, small amounts of liquid stool or smears in baby's diaper after days of no bowel movements. So we've gone through all the signs, and now you're probably wondering what could be causing your baby's constipation. There are a few things to consider. The type of formula baby is consuming, a milk protein allergy, low fluid intake, low fiber diet, and starting on solids. The following foods can also cause constipation if consumed in high amounts: yogurt, white bread, pasta, rice cereal, applesauce, bananas, cooked carrots, and cheese. It is also important to note that some medications can cause constipation. So if your baby is on any medication, it might be worth it to go have a look at the list of side effects. So now that you know the signs and causes of constipation, it's time to fix the problem, which brings us to treatment. But before we get into treatment, I want to take a few seconds to invite you to subscribe to my channel. Also, click the notification bell so you'll never miss important information that could be beneficial to you and baby in future videos. Now on to the treatments. First thing to do once you've confirmed constipation is to help baby exercise. Do this by laying your baby on their back and rotating the legs in a cycle motion as if riding a bike. Exercise will stimulate the intestinal muscles, which will then start pushing the stool. Next, you'll need to massage your baby's tummy. There are several ways to do this, and I will be showing you a few. For each method used in this video, baby will need to be placed on their back on a soft, comfortable surface. I like to do this on my bed. Massage number 1. Place a finger beside baby's belly button. Go around the belly button in a circular clockwise motion while you keep adding fingers. The aim is to get to your palm. You're also working outwards to the baby's side. Once you get to your palm, you'll want to add a gentle pressure as you continue to massage the tummy. Massage number 2. Place the soles of baby's feet together. Then, gently push back with the toes pointing to the nose until you meet resistance. Keep going back and forth with this as many times as comfortable for your baby. This method will also help your baby to pass trapped air bubbles. Massage number 3. Hold the baby's legs, big toes touching each other. Rotate the hips side to side while baby's top half is laying flat. Baby's legs can be straight or bent at the knees for this. Massage number 4. Hold baby's feet and gently bend the knees to the belly button. Repeat this as many times as you like, as babies usually enjoy this one. This is also another one that is effective with helping your baby to pass gas. And finally, massage number 5. Use your thumbs in a circular motion to massage your baby's palms and the soles of their feet. Treatment number 3. If baby is frequently constipated, it might be worth considering changing your baby's formula, as baby may have a sensitivity to the formula they're currently being given. With that said, you'll want to avoid changing your baby's formula every time they become constipated, as this will make things worse. Number 4, and this one will apply to babies 6 months and older. You'll want to give your baby a small amount of water daily to help them flush their system. I give my 7-month-old 2 ounces every day, and that's enough. Babies under 6 months old should not be given water. Breast milk or formula is enough. Just ensure that you're following the directions on the formula container. Number 5, give the baby a warm bath. This will help to relax the abdominal muscles, reduce strain, and ease discomfort from constipation. Number 6, milk of magnesia. This is one of my go-tos and it works every time. You will need to consult your doctor before using, especially if your baby is below the age of 2 years old. However, you can find this over the counter at any pharmacy, and the pharmacist will usually help you to calculate a dosage amount. They will need to know your baby's age and weight, or you could get your doctor to give you a prescription with a dosage amount. Milk of magnesia is a type of saline laxative that draws water from tissues nearby to the bowels to help soften stools. I've been using milk of magnesia to treat my son's constipation on and off since he was 5 months old. I do use the other methods that I have mentioned to you guys, but sometimes I'll need a little bit more, as I can tell my baby is still uncomfortable. So when I do need that little boost, I'll give him 5 ml, which is 1 teaspoon. It does take a couple of hours to work, so I usually put it in his milk in the morning or at bedtime. And usually by end of day or by morning, he'll have his bowel movement. Number 7, if baby is older than 6 months old, you can try organic 100% apple juice, pear juice, or prune juice. This juice contains a natural sweetener called sorbitol, which acts like a laxative when ingested. You will need to talk to your pediatrician about how much juice you should be giving to your baby. Number 8, if you started your baby on solids, then you can increase your baby's fiber intake. Offer foods such as fiber-rich cereals, pea fruits, prunes, plums, pears, and peaches. Vegetables such as broccolis, Brussels sprouts, beans, and peas. If none of the previous remedies works for your baby, then it's time for you to make a doctor's appointment to discuss different types of laxatives and infant suppositories. A glycerin suppository is a type of laxative that is inserted in the baby's bottom. These are very effective and will work in 15 to 60 minutes. Constipation must be taken seriously and resolved as soon as possible. The longer the child is constipated, the worse things are getting. The stool is becoming bigger, drier, more painful, and will be more difficult for them to pass. Even more dangerous, untreated constipation over a period of time could lead to more serious complications such as bowel obstructions. Do not hesitate to take your baby to the doctor if they seem to be having chronic constipation, meaning they're constipated all the time, as this may be an indication of an even bigger issue. So now that we've covered the signs, causes, and treatment options, you are ready to tackle your baby's constipation and prevent reoccurrence. I hope you found this video helpful. If so, give the video a like and don't leave without subscribing to my channel for lots more. Thank you guys so much for watching, and I'll see you again very soon.